Turn on.
Chair meeting. Please enter the meeting ID. Thank you. Please enter your password followed by the pound sign. Congratulations. We are adding you to this meeting. Your phone will be live, so everyone in the meeting will hear you, and you can hear the other speakers that are also live.
Hi everyone, this is Charles Boyle in the Governor's office. Looks like we have quite a few people on the line, so for the reporters online, please go ahead and press 0 to get into the question queue and work with the operator. We'll get started here in just a few minutes with our speakers, but again, if you'd like to ask a question during the press conference, please press 0 to work with the operator. Thanks so much.
Everybody ready? 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 Okay. All right. Good afternoon. Governor Kate Brown here. I'm going to turn it over to Dr. Dana Harganani for a few comments.
Thank you, Governor. Before we begin, I want to take the opportunity to talk about the logistics for today's press conference. As many of you know, the Oregon Health Authority recommends that when indoors with people who are not members of your household, that you should wear a face covering. However, today we are taking off our face coverings when speaking so that we can communicate with people who do not speak sign language and depend on seeing a speaker's mouth and lips. The speakers are 9 feet apart. The ASL interpreters are 7 feet from the speakers and 11 feet apart from each other. We have also recently upgraded the air filtration system in the building. Thank you, Governor.
Well, good afternoon. Thank you all for joining us today. We're here to give an update on COVID-19 and the challenges facing our hospitals as cases continue to spike and hospitalizations rise. I'm joined, as you know, by Dr. Dana Harganani of the Oregon Health Authority and Dr. Renee Edwards, the Chief Medical Officer at Oregon Health Sciences University. On the phone, we are joined by Dr. Jeff Absalon, Chief Medical Officer at St. Charles Hospital, Dr. Jamie Grabowski, Chief Medical Officer at Asante, and Jennifer Burns, Chief Nursing Officer at Providence Southwest. We all know that COVID-19 cases are surging across Oregon. Over the weekend, we saw daily case rates near 1,000. And yesterday, I announced that 9 Oregon counties will now be starting a 2-week pause as of Wednesday on social activities to help us slow the spread of COVID-19. Our fears that this virus would spread out of control when the colder months set in are certainly becoming a frightening reality. I've said this before, but from the outset, our goal has been to save lives and avoid overwhelming our healthcare systems. When people become ill, we need to ensure that there are enough hospital beds, PPE, and staff to provide life-saving care. Today, I've brought together hospital leaders from across the state to give an update on where we're at with our hospital's capacity and how we're preparing to deal with a potential influx in hospitalizations. This is very serious. Oregon is headed on the wrong road. While we have plans in place to share beds and ventilators if necessary, that needs to be a last resort. We cannot and should not be relying on the fact that our hospital systems can withstand a surge, but instead we should be working together to ensure they don't have to. I need Oregonians to know it's not too late to do the right thing. Every action we individually take, from wearing a mask to staying home when you feel under the weather, to truly limiting your social interactions, can really make a huge difference. Our fears that the virus can make a huge difference. Your actions can save someone else's life. You may be spreading the disease and not know it. Truly, lives are at stake. I'm now going to turn it over to Dr. Harganani to give an update on the COVID situation in Oregon. And then we'll pass it over to our chief medical officers and nursing officers to share updates from their hospitals. But I do want to close with this. Please don't forget your W's. Wear your face covering. Watch your physical distance. Wash your hands. And I'm going to add another W. Please, please, please don't go to work when you are sick. And finally, get your flu shot. It'll make a huge difference for all of us. Dr. Harganani.
Thank you, Governor Brown. Again, I'm Dr. Dana Harganani, the Chief Medical Officer for the Oregon Health Authority. I want to start today by thanking the hospital leaders that are with me today and also thanking hospitals across the state. And I especially want to thank the brave and heroic healthcare staff for all they have done during this crisis to help keep Oregonians healthy and safe. Every provider, support staff, and administrator around the state has been on the front lines of this pandemic every day since February, and we are all deeply appreciative of the efforts and sacrifices. Before going further, I want to mention where we are with COVID in Oregon. Today, we are reporting 771 new cases, bringing us to 51,909 total cases since February. We went from just under 40,000 cases 3 weeks ago to now nearly 52,000 today. I am deeply saddened to share that we have reported 3 new deaths today, taking the tally to 737 Oregonians lost to COVID-19. Meanwhile, for the week ending Sunday, November 8th, we reported a total of 51,155 cases. This is up by 5,177 new cases from the prior week. And the week before, there were 3,452 cases. The trend is clear and very concerning. And sadly, the pace of deaths continue to march along, with dozens of Oregonians lost each week. Finally, while the number of tests reported in this last week will also be higher than it has been in recent weeks, the percentage of positive tests does not look to have fallen significantly. Connected to high case counts are hospitalizations. Hospitals are seeing an increase in the hospital census numbers due to COVID-19. We currently have 285 hospitalized patients with COVID-positive tests in Oregon. We've seen a 57% increase in the past week since November 3rd in hospital census of patients who have been tested positive for COVID-19, and an 83% increase over the past 4 weeks since October 12th. We can also look at bed counts overall. In Oregon today, we currently have 146 available adult intensive care unit or ICU beds, 701 available adult beds that are not ICU beds, 130 beds for pediatric intensive care patients, and an additional 116 beds for pediatric non-ICU patients. When we look at hospitalized COVID patients by region in our state, we see that Region 1, which includes the Portland metro area, has seen a 57% increase in COVID-19 positive patients in the past week. Region 2, the Upper Willamette Valley, has seen a 36% increase. Region 3, which is the Lower Willamette Valley plus Coos and Curry counties, has seen a 79% increase in the past week. And Region 5, comprised of Jackson and Josephine counties, have seen a 162% increase in COVID-positive patients in the past week. Thankfully, we have more ventilator capacity than we did in the spring, and we feel confident about our understanding that there are 762 ventilators available in the state. This all brings me to our work in partnership with hospitals around the state to ensure that we're prepared for a continued surge in COVID-19 cases and hospitalizations. Since the H1N1 pandemic, we've been working closely with hospitals around the state to prepare for emergencies just like COVID-19. And while COVID-19 has been larger and longer lasting an event than we could have ever anticipated, we found that our foundational learning and planning has helped us be ready in the early days when we first saw these cases. That previous planning also provided a basis for a deeper relationship with our healthcare partners as we moved further into planning and preparedness for a new level of cases and hospitalizations. We now have in place multiple systems and plans that leave us much better prepared to handle high case counts and sick Oregonians. We are better prepared today than we were in February when we identified our first COVID-19 patient. Our regional approach to hospital preparedness and response remains the cornerstone for our planning. We work with our hospital partners across 7 regions in Oregon to make sure that if one hospital is unable to meet demand, other regional hospitals and partners can step in to assist. The basis of this arrangement is coordination, collaboration, and information sharing among hospitals at the region and state level. Capacity information at the regional level flows up to the statewide level. We help to coordinate with hospitals across these regions to understand what needs exist as we assist our hospital partners as they ready for challenges they might face. A key feature of this system is the communication and coordination that allows patient admissions to be distributed within a region or across regions if capacity is strained. And in good news, the system was put to test during our wildfires this fall, when we saw hospitals in close proximity to fires facing evacuation. The surrounding hospitals and the regional health system were able to communicate, coordinate, and flex to meet that demand, and in short, the system worked. But there are limitations to what Oregon's healthcare system can handle. Even with regional planning and the hard work of all of our hospital partners, we cannot handle ever-growing high daily case counts and widespread hospitalizations. The system is flexible and has capacity, but only to a point. For this reason, you've heard state officials for months say that we need each individual Oregonian to take steps to limit the spread of this virus. We must keep a new surge in cases from overwhelming our system. We know we can rely on our health system, our healthcare system and hospitals to manage their bed space, to manage staffing and supplies as cases increase. But they don't have infinite capacity. We need to rely on Oregonians to help us manage the virus by taking steps to limit spread. Oregonians are worn out, tired of a year with limited social connections and so many difficulties of all types. Our healthcare workers have felt this too, even as they continue to face the virus on a daily basis. They've done their jobs every day, all the while working with us to plan for another rise in cases. Let's repay our healthcare heroes by taking seriously the recommendations to stay physically distant, to always wear face coverings when you interact with anyone who lives outside of your household, and yes, to take the difficult steps of avoiding gatherings, even as we enter this holiday season. Together, we can manage to prevent a further surge that overwhelms our planning and puts us at risk. Thank you. Dr. Edwards?
Thank you, Dr. Harganani, and also thank you, Governor Brown. I'm very pleased to be able to join everyone today. Good afternoon, everyone. My name is Renee Edwards, and I serve as the Chief Medical Officer for OHSU Health, which also serves as the Regional Coordinating Hospital for Regions 1 and 6, which span from the Northern Oregon coast through the Portland metro area and along the Columbia River to the Dalles. Over the last 9 months, Oregonians have made tremendous personal sacrifices to save lives and prevent hospitals and health systems from being overwhelmed with patients critically ill with COVID-19. And for that, we and all frontline healthcare workers who continue to step up every day and care for these patients are immensely grateful. Last spring, as COVID-19 came into our communities, we and health systems across the state developed individual plans for each hospital to ensure that we could effectively manage a large influx or surge of critically ill patients sick with COVID-19. We also worked together within regions to coordinate these plans between hospitals. We had hoped to never need these plans, but last week, in response to a record-breaking number of COVID-19 cases and a large increase in the number of critically ill patients requiring the highest level of medical and nursing care, we had to crack open those plans, and in some hospitals, implement them in one or more of our intensive care units for the first time. There's no question that we are at a crossroads. And I'm here again today to ask for your help in flattening this rapidly developing COVID-19 curve to save lives and preserve hospital capacity. If we closely follow the safety measures that Governor Brown has put in place to pause activity and continue to adhere to all existing protective guidelines, we absolutely can change the current trajectory and stop the spread of coronavirus through Oregon. Together, hospitals and health systems across the state are committed to doing everything we can to care for all those who need us. Oregonians require care for many other conditions than just COVID, and we need to maintain the hospital capacity and healthcare workforce to address all of these needs in addition to COVID-19 patients. With the number of COVID cases that we've seen over the last few months, we've been able to balance our care for all. But with the currently rising numbers, we are at risk of no longer being able to maintain this balance. To that end, we continue to closely coordinate our efforts in partnership with county, state, and regional public health officials to ensure that we have adequate staffing, supplies, beds, ventilators, and other equipment. But we urgently need your help now. The COVID cases that we're seeing today have already locked in the hospitalizations that we'll see 2 weeks from now, as it takes about 2 weeks for patients who are infected today to become ill enough to require hospitalization if that is indeed going to be the trajectory of their disease course. By pausing now, we're trying to prevent these numbers from getting even bigger and impacting us farther down the line. To protect ourselves, our loved ones, colleagues, and our community from infection, and to protect our economy, it's critically important that we follow the governor's guidance and avoid social gatherings. Please stay home to the extent possible, and if you must go out, wear a mask, stay 6 feet away from others, and wash or sanitize your hands frequently. Please do not go to work if you are sick. It's also important to remind everyone that you could be infected with COVID-19 and unknowingly passing it on to others, especially in the 2 or 3 days before you even develop symptoms. For some people, symptoms may be so mild that you don't even realize you're infected with COVID-19. That's why wearing a mask, even when you don't feel sick, is so essential. Wearing a mask, keeping your distance from people may prevent the virus from infecting others without your knowledge, just by talking to someone close to you. I want to close by acknowledging, as Dr. Harganani did also, that everyone is exhausted, frustrated, and grieving by this historic pandemic. I extend my sincere condolences to everyone who has lost a loved one, friend, or colleague to this disease. And I also want to take a moment to recognize those who've lost a job or who are experiencing financial losses as COVID-19 has wreaked havoc on businesses and employers. In Oregon, we've endured a number of combinations of crises this year, but we can't let our guard down quite yet. Some of the world's brightest minds are working together to develop new medicines and a vaccine that will allow us to return to the activities we love. We got new information on this front just this week. So hope is in sight. But until then, to protect your health and safety, our hospital capacity, and our economy, we strongly urge you to follow the guidelines set forward by the governor and our state and federal public health officials and pause or cancel any social gatherings. Thank you for your continued support.
Thank you, Dr. Edwards. Good to have you back. We now have on the phone Dr. Absalon. He's the Chief Medical Officer at St. Charles Hospital in Central Oregon. Dr. Absalon.
Thank you, Governor. Thank you all for attending today. My name is Jeff Absalon. I'm the Chief Physician Executive for St. Charles. We have 4 hospitals in Central Oregon. Our largest hospital in Bend is the Resource Hospital for Region 7. Region 7 covers 8 counties, all east of the Cascades, from Central Oregon down to the California border. We are also very concerned. We've seen a doubling in our inpatient cases over the course of the last week. We are at the same level as our highest amount of COVID inpatients earlier in the pandemic, and we recognize that we are just entering into flu season. And so we're very concerned about what's happening here today and what we might see in the upcoming weeks, and again, ask for your help. The holidays are upon us. It is cold in Central Oregon, and we acknowledge that people are indoors. And all of these are factors that we think are important that are going to require increased attention. I do want to share with you guys a little bit about what we're doing and what people might expect if we get to a place where we're becoming overwhelmed. We, as every hospital and health system in the state, have developed surge plans, and they start with rebalancing of patients between our facilities. In other words, sending patients from Bend to our outlying hospitals, or vice versa, which is what we're doing for all COVID-19 patients. And this, of course, has an impact on patients and families in terms of getting their care outside of their local community. We do have a good amount of supplies in terms of extra beds and ventilators, but staffing is really an issue as we bounce up against our capacity constraints. We will have to reduce elective surgeries. Many of these are elective surgeries that people have delayed throughout this pandemic, but if our numbers get any higher, we will need to do that. And additionally, if we hit a crisis point, we may need to shut down our elective surgeries altogether so that we can utilize the staff that work in our operating rooms and the supportive areas to take care of sick patients. And this is not what any of us wants to do. So again, we call on you to take action to prevent the spread of this disease. We really do need your help. If you do your part to prevent the spread of this virus, you are directly helping our frontline healthcare workers. And many of these workers are balancing full-time work with parenting and teaching responsibilities in this current environment. We need them rested. We need them available to help you and all of those in need when care is necessary. Overwhelming our health system is not what any of us want. And I'll also add that the same actions that will prevent the spread of this disease to help our hospitals and healthcare workers may allow our kids to get back to work, back to school safely, which I know we all want. The last thing that I just want to share with everybody is that this is really an important message. We've learned a lot in this pandemic. One of the things that we learned early on was that people delayed care in the pandemic because they were fearful or were concerned about overwhelming our healthcare systems. We want to make sure people know, please do not delay care. If you need to access our healthcare systems, they are safe. We have all worked hard to make sure that our environments are safe. They are. And if you need healthcare, please access care as necessary. So that's a part of the message we'd love to have you hear as well. But again, just reinforcing what's already been said, please wash your hands, please keep your physical distance, please wear your mask to protect those around you, and we appreciate your time today. Thanks, Governor.
Thank you, Dr. Epsilon. Next, Dr. Jamie Grabowski, Chief Medical Officer at Asante in Southern Oregon, Medford.
Thank you very much, Governor, and thank you to the press for this opportunity to address this really very important question today, and really to enlist your help to communicate to your readers and your listeners and your viewers about the importance of some of the key messages that we're getting out today. I'm Dr. Jamie Grabowski. I'm a family doc. I'm the Chief Medical Officer at Asante Healthcare Systems. We are headquartered in Medford. We're a 3-hospital system, and our largest facility, Rogue, acts as a regional facility during this outbreak. You heard earlier on that our region has really seen a logarithmic rise in cases, 162%, I believe was the number that was shared, and we've seen that, as you've heard, in increased hospitalizations. We've seen over the last few days a threefold increase in the number of cases. In fact, as I'm sitting here, I see in our list that we just admitted another patient to one of our facilities. And so we don't, for the short time, see a slowing of that increase in hospitalized patients. We also see a challenge on discharging our patients as well. And so as the pandemic has spread locally, skilled nursing facilities, intermediate care facilities, memory care, other places that act as discharge locations for an acute care facility are really unable to accept patients, either because they have COVID in the facility or that there are staffing issues. And that really impacts our ability to care for the community in our capacity. For example, in Medford, Rogue had 15 patients waiting for a placement. In our Grants Pass area, Three Rivers, there were 10 patients waiting for placement. You know, Oregon has a legend of rugged individuality, but the reality is that this pandemic really requires a community and cooperative response to really address the root causes of what's driving this pandemic and really reverse that. It's not too late to continue to change and alter the trajectory of this pandemic. We've done it before. Any of you who have seen the curves and trajectories know that there's a rise and with a response comes that trajectory bending. We've done it before and we can do it again. And really, we need to get out those clear messages about utilizing masking in public, limiting gatherings, even during these important holiday seasons, and assisting our local public health departments in contact tracing and those sorts of things to help us bend this curve. You know, the other day I had somebody ask me how I was holding up during this pandemic, and, you know, I responded, other than my residency training, I'd never worked harder in my career, but I've also never been prouder of the work I've been doing. And what I'd like to do is that right work. I'd like to make sure that we're preventing the spread of this illness and bending the curve. Sure, I can be doing work, looking and helping make sure we're triaging appropriately and responding to an increasing pandemic, but I sure would rather be doing the work to make sure that we're bending that curve and we're doing the kinds of things to prevent our citizens in Oregon from getting ill in the first place. So I ask you to help get that word out, help spread that word so that we can be successful and give time for advanced therapeutic options and vaccination options that you've heard about to develop so that we have a better ability to respond in the future. Thank you very much.
Thanks, Dr. Grabowski. Next up, we have Jennifer Burns. She is the Chief Nursing Officer at Providence Southwest and is in the metro area. Take it away, please.
Thank you, Governor, colleagues, and members of the press. I'm Jennifer Burrows, a registered nurse, and I currently hold the responsibility for being Providence's Chief Clinical and Nursing Officer for Oregon. I work closely with our nurses, physicians, and caregivers across the state. Providence is the state's largest healthcare provider with nearly 23,000 caregivers in Oregon and services from Columbia Gorge to the North Coast and south to Medford. I want to thank my colleagues and echo the points that they have already made. We are also seeing an uptick in COVID hospitalizations. We have gone from 34 inpatients to 58 in a 7-day period. We have just surpassed our highest inpatient number that we have had in any of our previous surges. We have planned for this. We're working hard together with our healthcare systems and colleagues in all the areas that we are in the state to care for the Oregonians in those communities. We do need everyone's help, however, to keep our hospitals available for the care of people in those communities. I am part of a larger Providence team that cares for communities across the western part of the United States. We have an active presence in 7 states. We were the first healthcare system in the country to care for a patient with COVID-19, and since that time, we have leveraged our health system to innovate and participate in clinical trials, learn faster from each other on how to care for people stricken with this virus, and analyze our internal data to care for the communities we serve in. We have firsthand knowledge of the COVID-19 surges in Seattle, Southern California, and West Texas. That informs my view of where we are as a state today and how the decisions we make today as individuals impact our hospitals, emergency rooms, and physician offices in the weeks ahead. I know we are tired. We're all tired. I'm the mother of children in the Portland public school system being taught virtually. I'm the wife of a husband who has worked remotely since March. I am one of those people in the grocery store working harder to accomplish my weekly to-do list than I did a year ago. But I'm also a nurse and a voice for the professional clinical team that wants to be ready and able to effectively care for you if you need our services. We have witnessed the devastation that this illness can bring to people, families, and communities. We as the people of Providence want to be able to continue to care for people who have illnesses that are not COVID-related. We need your help with this. We need you to make wise choices. Our nurses and frontline caregivers are our most precious resource in fighting this virus. They are our heroes. We need the public's health to keep them safe. As we enter into this holiday season, Providence wants all Oregonians to be of good health. Thank you.
Thank you very much. I think we're ready for questions.
Thanks again. For press who are listening, that was Jennifer Burrows, Chief Clinical and Nursing Officer at Providence Southwest. We're going to start questions first with Sarah Hurwitz at KPDV. Go ahead, Sarah. Sarah, are you there?
Yes, I am. Thank you so much. I had a question for any one of the medical directors on hand. I'm curious if Oregon is being asked to provide any kind of help to other states in our region. And if that is the case, what is the threshold for our state in terms of how much can we help before we're going to need help ourselves when it comes to hospital capacity?
Dr. Harganani, would you like to take that one?
I'll start and pass it off. Thank you for the question. Again, this is Dr. Dana Harganani, Chief Medical Officer for the Oregon Health Authority. We are receiving this question a lot. I think first I just note, based on the way our state communities are distributed, there is a natural amount of movement that happens with patients seeking care across our borders with our state partners. Right now, everything we know is that is about normal stage. That type of normal patient movement across health systems, for example, over state borders is normal. We do know that other states are stressed, and we also have been talking about today the rising case counts here, so we're watching this closely. Dr. Edwards, do you want to add to that?
Thank you, Dr. Harganani. I would definitely echo the comments that you've already made. The only addition that I would add in is that many of the large hospitals and health systems in Oregon, certainly including OHSU, serve not only as sites for the local communities and for the state, but also for the region. And as a result, we do receive on a regular basis transfers from other hospitals that are in the Northwest region when we need to provide care for patients, particularly who have specialized healthcare needs. As Dr. Harganani mentioned, we really have not seen a change in that referral pattern at this time. The exception would be that for some highly specialized care, for example, something called ECMO, which is an external corporeal way of supporting the heart and lungs in critically ill patients, there actually exists a regional network across Washington, Oregon, Idaho, and other states in the Northwest region that partner together for these highest level of critical care needs. So we do receive patients from other states in that regard, but otherwise, to this point in time, it has been typical referral patterns.
Thank you, Sarah. We'll go next to Blake Allen in Bend. Go ahead, Blake.
Yeah, my question is for the governor. Is there any possibility that Deschutes County is being eyed for a possible pause, as is like with other counties?
Look, I have put 9 counties based on their coronavirus infection rates on a 2-week pause. We are at a crucial point in Oregon right now, and that's why we're here today. We're asking all Oregonians to redouble their efforts to slow the spread of the disease and reduce transmission. I've obviously said the handful of ways that each one of us can make a difference. But I would say at this point, given the surge that's happening across the entire world and across the United States that all counties are at risk for additional changes and further closures. And honestly, each one of us can make a difference, and the citizens in Deschutes County can do their part and help slow the spread.
All right, thank you.
Thanks, Blake. We'll go next to Tim Gordon with KGW. Go ahead, Tim. Tim, are you there?
Hi, can you hear me?
Yes, go ahead.
Hello?
Yes, go ahead, Tim.
Yeah, I am. Hear me?
We'll go next to
Oh.
Lachey Wesley with K2. Go ahead, Lachey.
Hi, good afternoon. I had a question about the emergency rooms. How have emergency rooms been impacted? And my other question was for OHSU. I was wondering what specific changes needed to be made last week in response to a rising number of hospitalizations.
Thank you.
This is Jamie Grabowski. I can take a bit of that first question from Sante's perspective. We have seen an increased volume in our emergency rooms. We are working to make sure that we can manage that as appropriately as possible. We have set up regionally a COVID hotline. I heard today that we had 100 calls an hour into that COVID hotline for the first 2 hours of the day in preparation of this talk. And what we do there is we have a nurse who helps triage a patient to decide what the right level of care they need. Do they need a virtual visit? Do they need an in-person visit in an urgent care that's safe for a patient with potential COVID symptoms? Or do they need to go to the emergency room? So we're helping regionally to make sure we're appropriately triaging and providing the right resources to our community members.
Dr. Absalon, do you want to give an update from Central Oregon?
Yeah, thank you, Governor. We've been doing pretty well with regards to our emergency department. I think we also have a hotline, as Dr. Grabowski described, for Southern Oregon, and it's been serving the same type of a role. And so we've been working hard to direct people to get care in the appropriate location. So far, we're doing okay with this. We are, as I mentioned earlier, running towards flu season when we will expect to see increased volumes in our emergency department, but at this time, we seem to be doing okay.
Thank you. This is Renee Edwards from OHSU. Thank you for the question that I referenced. As part of the preparation work that Dr. Harganani mentioned, that all of the Oregon regional areas have completed. Over the summer, each region was asked to submit to the state a preparedness plan for their specific region. And so in regions 1 and 6, we submitted a plan that looked at the capacity of our ICUs and what percentage of our hospitals within the region were at that threshold capacity. And when we reached that threshold capacity, two things would happen. One is that it would trigger what we call a regional huddle, meaning that any of the hospitals within the region can make a call to say we need to pull together all the hospitals in the region into a phone call to discuss where we are with capacity and understand whether we may need to share some of our patient load with other hospitals in the state. So the first thing to note that happened last week is that in regions 1 and 6, we began regularly meeting our ICU thresholds that we had submitted to the state. And as a result, we are now having almost daily regional huddle calls to discuss our hospital capacity, including our ICU capacity, and make sure that no one hospital is reaching a stress point with being able to manage their capacity. At OHSU in particular, we have 4 ICUs, and we created a plan that if we reached a critical number of COVID patients, we would place all of those COVID patients requiring ICU care in a single ICU and place the non-COVID patients in other ICUs, and we activated that plan last week.
Thank you.
Thanks, Lachey. We'll go next to Aaron Ross with OPB. Go ahead, Aaron.
Hi, can you hear me?
Yes, go ahead.
Okay, just very briefly, could you have someone spell both the names of Dr. Grabowski and Dr. Epsilon?
Yes, we can send those to you right now by email, Aaron. Thanks. Do you have another
Great,
question?
thank you. Yes, I do. So it sounds like we're seeing cases rise at a rate that we did not necessarily expect them to rise, going, doubling the number of patients in some hospitals, seeing 168% in cases in other areas. Are we prepared? We're prepared for what we're seeing right now, but are we prepared for this type of increase to keep going if we keep having this logarithmic increase in cases?
Thank you for the question. I can start out. This is Dr. Harganani with the Oregon Health Authority. I do believe that so much of the planning that has been done by our hospital partners and with the state are really helping prepare us for what will come with future hospitalizations and COVID cases. But as I mentioned earlier, it's not infinite in its ability. And so I think, again, we'd go back to the critical message today that you all, individuals across Oregon, have the capability to help us reduce the surge and reduce the transmission, to help with the hospital capacity and reduce the impact. There's a lot of tools that our hospital partners have to manage capacity, so I'll pass it off to any of them who want to add from their perspective.
Or if I could just give a follow-up, so we have the fourth highest rate calculated, the fourth highest RT in the country right now. So if Oregonians do not step up their game and practice better social distancing, will we be able to handle that rate of increase?
Look, here's the reality, and here's why we're here today. We're at a critical juncture for Oregon, and this is truly a wake-up call to all of my fellow Oregonians. I know you're all tired. I know you're exhausted. I know that you have made tremendous sacrifices to reduce the curve early on in this virus, and those sacrifices are impacting our families, they're impacting our schools, and they're certainly impacting our businesses across the state. But the harsh reality is it is not too late. We can change the trajectory of this virus. Each one of us taking actions by washing our hands, watching our physical distance, making sure that we're wearing masks, staying home if you are sick, and of course getting your flu shot. In addition, as we see from the 9 counties that are going on a 2-week pause, limiting social gatherings is absolutely key. I've been saying that over and over again. I know that Dr. Seidlinger has as well, and other folks from the Oregon Health Authority. But we are asking Oregonians to limit your social gatherings to your own household or immediate family. We have got to keep these gatherings small. We know that these gatherings are the source of much of the spread throughout the state. So we're at a critical juncture. You can make a difference. Please, we have had one of the lowest infection rates throughout this entire pandemic, one of the lowest infection rates in the entire country. But as you just said, our cases are increasing rapidly. We can stop the spread. We can slow the transmission of the virus. Each one of us can make a difference.
Did anyone on the phone want to address any of those questions as well?
This is Jeff Asplund from St. Charles, and I can just say that when the pandemic started, we all got together within our teams to build these surge plans. So I know we all have them in place, and they really do start with lower level impacts to, if we have a really significant increase, changes that will be dramatic. We can put beds in waiting rooms. We can put beds in conference rooms. The staffing is going to be really the challenging part of this. And so none of us wants to go there. We would much rather be able to take care of our communities with the resources that we use every day and people that are doing this specific work on a regular basis. But you should be rest assured we've all planned accordingly. It just would be incredibly difficult, so please help us in this endeavor.
Yeah, this is Jamie Grabowski from Asante. You know, if there is such a thing as a silver lining to this pandemic, I will say prior to the pandemic, I hadn't had the opportunity to work with Dr. Harganani or Dr. Edwards and just a bit with Dr. Absalon, but, you know, we now collaborate at least on a weekly basis to make sure we're as prepared as possible and that we're sharing ideas and coordinating and collaborating so that we're able to respond to the virus effectively. That wouldn't have happened had not this pandemic occurred. And I think one of the other things that the governor's done that has been really helpful is to help regionalize the care so that on a regional level we can respond to the pandemic as appropriately as possible, which didn't exist prior to this time. So really tremendous changes in the degree that we've been able to work together has happened as a result of this pandemic.
This is Jennifer Burrows from Providence, Oregon. I just add, I agree with everything that's been said at this point. I would just add, kind of a call out that our resources are finite. And so as we see an infection rate surge, there will be a point where we don't have enough resource without really changing the way that we stretch kind of the way that we would normally take care of people. We are also seeing illness in our caregiver teams across the state, and as the amount of illness grows in the communities, we are struggling with illness in our own hospitals as well, and so that also has impact. Making sure that there's enough respiratory therapists to take care of patients, making sure there's enough nurses, ensuring that there's enough providers, and as the infection rate grows in the community and the spread grows in the community, there's also the potential to be infecting people that we count on to take care of the people who are most stricken with illness as a result of this virus.
Thank you, Jennifer.
We'll go next to...
This is Jamie Grabowski again. I'll just emphasize, in a role like being a chief medical or chief nursing officer, you have a lot of choice in the work you do. You get to choose your direction. I think we as a state are at a point where we need to make a choice. Are we going to really engage in these efforts to bend the curve, or are we going to spend our resources and time and energy in other areas? I would strongly advocate for us to take the path where we choose to engage in masking and hand hygiene and limiting social gatherings and getting a flu shot and those kinds of low-cost, high-benefit interventions.
Thank you. And we have time for just a couple more questions, so we'll go next to Lisa Balick with COIN. Go ahead, Lisa.
Yes, hello. Question for Dr. Harganani and Dr. Edwards. When you talk about the number of available beds, is there a point at which certain hospitals would not be able to accept non-COVID emergency patients, like those in a car accident or having a heart attack? How realistic is that? And then what would happen?
This is Renee Edwards from OHSU. Thank you for that question. I think we are back to the point that we do and we will continue to care for all the patients requiring our care. But as has been mentioned several times, first by Dr. Harganani, we have an infinite number of resources. When patients come into our emergency rooms, when they come into our hospitals and doctors' offices, we will deliver care and we will be there for you. But as Dr. Absalon mentions, if we start becoming overwhelmed, then pretty soon those beds are in the hallways instead of in a room. Or the nursing staff that we need to utilize to care for patients rather than caring for 2 or 3 patients at a time are caring for 5 or 6 patients at a time. So I want to emphasize emphasize that this is not about your hospitals and healthcare systems being there for you and the healthcare workers who will be there to provide your care, but it's understanding that we only have so many resources. And so we want to be able to be there still for the unfortunate things like the car accidents or the heart attacks. This is why we're asking for your help today. The other thing that I want to say is that we have to remember that when a person becomes infected with COVID, it does take up to 2 weeks before they start developing symptoms. We're here today asking for your help, and we know that Oregonians will respond because you have already done so beautifully so many times before. But don't get discouraged if you don't see the numbers start coming down right away, because we know that it takes a little time to start seeing the impact of the actions that you're taking today have a real difference in the numbers that we see even a week or 2 or 3 from now. So hang in there, and even if we see the numbers still not quite going down yet, know that the actions you take today will have an impact on the numbers 2 weeks from now.
Thanks, Lisa. We have time for just one more question, so we're going to go to Sarah Klein with the Associated Press. Go ahead, Sarah.
Hi, yes. As we approach flu season, and OHA has obviously put a focus on avoiding a twindemic, I am curious what the average flu season looks like in Oregon. How much do hospitalizations typically increase by during that time? Is there added staff and the amount of deaths?
Argonani, do you want to take that one?
Sure, thank you, Sarah. Really important question to call out on top of our focus today around COVID-19, the importance of our entering the flu season, and all of the same measures to reduce the transmission of COVID will also help us reduce the transmission of the flu. Again, also getting your flu shot will be critically important. We do track this data on flu every season and very closely, and are able to compare it to national data. I do not have that memorized today. We welcome people to sign up for weekly notices to come about the trends that are happening in our state, and we will be sure to get that data to you, looking at last flu season and what we're seeing today. It is certainly early. We're just seeing a handful of flu cases in our state so far, but we're tracking it closely, and we'll certainly get that information to you.
Thanks so much, Sarah, and thanks to everyone, our speakers, for joining us today. That's all the time we have for questions. So.
Thank you all very much. Be safe out there.